Well, good morning, all. Thank you for joining us for our semi-annual MDHI stakeholder meeting. Just a few kind of housekeeping things. If you can please make sure that you are on mute. We will have time for questions kind of throughout the presentation as well as at the end. So if you can stay on mute until you have a question and then raise your hand or put questions in the chat. And then if you can start by introducing yourself and with name, organization, and the fun fact we picked for this morning is your hometown. Oh, and I should probably start, sorry, introducing myself. My name is Kyla Moe, and I am the Deputy Director here over at MDHI. And next slide, please, Layla. So today's agenda, we will be doing kind of welcome and introductions again in the chat. We will be doing a quick celebration for the Housey Firstie nominations that you all sent in. So thank you for sending those in. And then we will be covering COC membership. What does that mean? What does it mean to be a COC member? We will have a presentation on our youth homeless demonstration project. We will take about a 10-minute break. And we know this is a 2-hour meeting, so trying to break it up a little bit. And then we will come back from break, have a coordinated entry update, a regional coordination update, and then overall updates. And then we'll have a wrap up at the end. And again, we will save time at the end for questions, but feel free to type in questions in the chat as we go, and also raise your hand throughout the presentation. Next slide. And then again, just some housekeeping, make sure you stay on mute. There's the instructions for how to introduce yourself in the chat. And then again, we will take questions throughout the meeting. So I am going to hand it over to Layla to kick us off.
Hi, everyone. Good morning. My name is Layla Saeed. I am the communications specialist at MDHI. Housing Firstie is intended to celebrate people in the community who are there's so many people doing great work, but it's always nice to shout out a few people specifically during this time when this work can be really difficult. It can burn us out a lot of times. But there are so many people in this community who really show up every day with their whole self and really put the people we serve first, and even the people they work with as well. So thank you to everyone. And I just think, if there's anyone you'd like to recognize, a colleague during this time in the chat, if you didn't have a chance to recognize them earlier, feel free to just do so and drop that in the chat. So I'm going to go through and just recognize some individuals. So Midori Higa, many of us know Midori. She is amazing. She's the Director of Homelessness Resolution Programs at the City and County of Denver. Midori is a tireless advocate for people experiencing homelessness and providers. She helps us all navigate complicated contract systems, funding cycles, but never loses focus on the why. The why is always about the people we work with and how to be better for each other. She is a quiet leader who deserves to be celebrated. So thank you, Midori, and thank you, Christina at Urban Peak, for sharing this shout out with us as well. Jolene Sanchez from the Empowerment Program. Jolene is trauma-informed, participant-centered, and is utilizing the Housing First model every time. She is our peer specialist for HOPWA, so her main focus is housing, and boy, does she put her all into it. She is helping us get participants housed and off the streets. I have enjoyed having her as a team member and someone to learn from. Sarah Stella, MD at Denver Health. Dr. Stella is an internal medicine hospitalist at Denver Health who champions caring for patients experiencing homelessness. She has led a number of important efforts at Denver Health to identify people experiencing homelessness and support linkage to services and housing, including 1, developing an electronic health record registry for patients experiencing homelessness, 2, leading efforts to diagnose patients experiencing homelessness for visibility on medical claims and improve recognition of high risk, 3, leading Denver Health's involvement in the Social Impact Partnership Pay for Results Act grant to link eligible patients experiencing homelessness to permanent supportive housing. And 4, leading collaborations between Denver Health and Colorado Coalition for the Homeless, including securing a CCTSI pilot grant to convene a community advisory panel to understand experiences people had during and after hospitalization, especially the trauma people experience through homelessness and with healthcare. She has also participated in the point in time count and several other regional efforts focused on addressing homelessness. So thank you so much, Dr. Sella. It is amazing to see the interaction between the hospital system and the homelessness system, and to see people across systems working together to improve the lives of people experiencing homelessness. We also have Chantel Anderson at Recovery Works. Every day, Chantel brings enthusiasm and experience to each and every guest who walks through the door at the Navigation Center. For the past 3 years, she has engaged some of the most vulnerable unhoused neighbors in Jefferson County and gotten them on the road to recovery and stable housing by providing emergency services and comprehensive housing-focused case management. She has brought strong leadership to a new program and never gives up. Seems to be a high degree of frustration and hopelessness due to lack of resources. Chantel is a shining light in our community. Thank you, Chantel. Thank you for bringing that energy and that enthusiasm to the people we serve. And I believe this is the last, certainly not least, Laura Getz from the Aurora Housing Authority. Laura Getz, Manager of Homeless and Housing Stability Services at AHA, leads a team of 4 social workers plus an MSW intern who are working in a lot of acronyms, FUP, FYI, VASH, RRH, Housing, HP, and PSH, and these are all different housing programs. She also carries her own caseload, mostly working with McKinney-Vento families. She manages all the programs and staff working in homelessness services. Laura ensures data is up to date, tracks outcomes, and diligently submits reports in a timely fashion. She is active in MDHI efforts, frequently attends DOH webinars to keep informed of new development and seeks support, and has participated in Aurora's Built for Zero case conferencing. When the Aurora Built for Zero cohort was honored for data quality recently, Laura was present to receive the award as part of the team, demonstrating her passion for this work. As a manager to staff, she problem solves, helps clear barriers when case managers have hit a wall, and juggles many different personalities and strengths to form a cohesive unit pulling toward the goal of ending homelessness in our community. As a case manager, Laura is compassionate, empathetic, resourceful, and thoughtful in working with program participants. Every day, Laura works to make sure the families, youth, and veterans we serve are stably housed and will be so in the future. As a colleague, Laura is reflective, joyful, and confident in sharing her opinion in a way that moves conversation forward. I could not ask for a better person, professional, and social worker in her position. She brings her whole self to work, and doing so makes all the difference. And that really does make all the difference. So thank you, Laura, so much for all of your work in our community. So I will, let me see if I could just get rid of that. Okay. Move on to COC membership. So how can you join our COC, and what does it mean to be a COC member? So COC membership, it ensures community-wide commitment to preventing and ending homelessness, and it must represent a diverse body of stakeholders throughout the COC. And the geographic area that we cover includes Adams, Arapahoe, Boulder, Broomfield, Denver, Douglas, and Jefferson counties. And there are a few benefits to COC membership. So membership is free, and organizations who are a member can apply for funding opportunities that are passed through the COC by HUD. There's at least, I think, 30 million a year that we subgrant annually to different nonprofits and government agencies in the region. You can also vote at annual stakeholder meetings like this one. Voting is limited to 1 designee per member organization. I don't think there's any voting items today, but they do come up periodically. You can support COC committees as voting members with the authority to make formal recommendations to the COC Board of Directors or Continuum Performance Committee as applicable. So our COC committees are different ways to engage on more specific issues that we're trying to tackle in the COC. And we like to have diverse representation across regionally with people with lived expertise, people working in different sectors and industries. So you can always apply to those committees if you feel like you have something to contribute. And you can also receive technical assistance from MDHI and its partners to support the implementation of effective program operations, HMIS related, coordinated entry related. We have a lot of great people supporting providers every day out in the community, and that is a benefit as well. So the application for COC membership is open to organizations and people with lived experience. And you can apply at mdhi.org/COC. You can scan this QR code. It's a pretty simple application. There is a renewal process each year that we're required by HUD to complete annually. And there usually is just an automated email message that you will get to reapply. So if you ever see an email asking you to apply again, and you're like, but I already applied, it is just a renewal that we just ask that everyone just complete annually. And it's pretty much just the same form, but we just get a new submission date and are able to see that in our system. So thank you to everyone who has joined our COC. And if anyone has any questions about applying, I can also put our info email in the chat as well. And you guys can submit any questions there. So I will pass it over to Zeta Bradford on our team. I've had the pleasure of working with Zeta for a few years, and I'm so excited that she's now joined our staff as our YHDP fellow. So really excited for her to present to you all now.
Thank you so much, Layla. Grand Rising, everyone, this morning. I'm glad to be here to present to you guys. Some of you I've presented to before, so welcome again. And for those I haven't presented for, I'm glad you're here and I hope you have a good time. Next slide, please. Oh. So what is YHDP? For some of you, you guys know that majority of MDHI does, but for those of you that don't, the YHDP is the Youth Homelessness Demonstration Program, which is an initiative by HUD aimed at preventing and ending youth homelessness across the United States. Next slide. So some of our goals of the YHDP are to support communities in the development and implementation of innovative, comprehensive practices or approaches to addressing youth homelessness, to create sustainable systems of care that can be replicated in other jurisdictions, to foster opportunities to practice and demonstrate our understanding and knowledge of authentic youth collaboration, or AYC for short, provide opportunities that recenter youth decision-making processes, and practice allyship between community partners, while also practicing diversity, equity, and inclusion, DEI, throughout the YHDP process to infinity and beyond. So some of our key components that we've been using for this project is youth involvement. We prioritize the engagement of our young people with lived experience. They are the center of all that we do. While also in all aspects of our program, from planning to implementation to evaluation, community collaboration also encourages partnerships among local agencies, nonprofits, government, and youth advocates, while also having the innovation to support the testing and evaluation of new and effective ways to prevent and end homelessness among our youth. Next slide, please. So our structure of YHDP, it is a competitive grant program providing funding to selected communities. And if I'm not mistaken, we are round 7, so they've done this for quite a while. Focuses on creating a comprehensive community plan, or our CCP, to coordinate efforts and resources. And also we've been using this to emphasize the use of evidence-based practices and data-driven strategies. So with that, this is our YHDP governance that we've used to make all the decisions throughout this whole process. As you can see, we have our young adult leadership at the top, because as I said, our youth are really the center of this project, and everything flows through our YALC to make the final decision. We also developed the Youth Task Force, which has since been updated to the working group. Sorry for the delay. that is not updated here. And we also have been working hand in hand with our COC board to get as much information and as much feedback as possible to make sure that we are selecting programs and projects that will actually help our community. Next slide, please. So why does all this matter, right? This addresses the critical gap in homelessness services by focusing on the unique needs of our youth in our community, while also building a foundation for long-term change and ensuring that every young person has a path to stable housing, and sustainable housing at that. And a future free of homelessness. And if it's not completely free, at least the resources available to end the homelessness as quickly as possible. Next slide, please. So some of our achievements to date. So back in September, we were awarded the $2.5 million in September. We were very excited. It was very happy, still very happy, honestly. I love bragging about this to everyone I come in contact with. Our Young Adult Leadership Committee, hi. We've been leading the work, really. We've been so involved. We've been trying our very hardest to make sure that this is helping our youth in our community and making sure that they feel valued and listened to. We have done our request for proposals. That's not supposed to be funding, it's supposed to be proposals. I caught that this morning, but our request for proposals is complete. Our youth was very involved in that as well. Our community plan has been approved by HUD, which we are super happy to be done with. And also we have selected 5 grantees for this round of funding to use this $2 million to help our youth. Next slide, please. So some of our learnings, this timeline has been really, really fast. We are already back at September of 2024. This timeline has been exponentially fast. On top of that, there are a lot of tight deadlines and a lot of turnarounds for this project as well, which has been a little bit of a struggle, but we have managed and we're glad that we did it. We're glad to be here. We're glad to be learning, and this is definitely a learning process. We're still actively learning. Even as I talk to you today, I'm still learning new things. And we are grateful for our HUD technical assistants. They have been literal angels throughout this whole process. They have been teaching us everything we need to know, helping us as best as we can. We've had a lot of back and forth with our TAs about everything that we need to do for this project. So they've been very helpful. Our CCP was very detailed and it was a little intimidating, but we're glad it's over, it's finalized, and it is officially approved by HUD. And we're so glad to be releasing that to the public soon. There's a lot of work that goes into applying, being awarded and actually using this fund. So we're very excited to see all of our hard work go into production and actually start helping our youth. Next slide, please. So this is just a more detailed YHDP timeline and overview of what's been happening. So back in November 2023, we had our first community partner kickoff. We got to meet everyone in the community. We brought everybody in, just gather some information, wanted to know what's going on in the community. What do people feel like our youth need? Stuff like that. Continuing right on into December, the YALC led a training on authentic youth collaboration with some of our community partners. Segueing into January 2024, we were having in-person community planning sessions focused on system modeling, starting to put pieces of our CCP together and getting more and more information. Continuing right on into February, we were continuing with those in-person planning sessions while also having weekly meetings with our technical assistants, just coordinating, getting everything together, final details. Going into the beginning of March, we ended our weekly community meetings. We had all the information we needed. Now we started implementing and actually creating our CCP and writing it. Between March 14th and March 26th, we wrote our CCP or compiled it. We reviewed it by our partners. We had final edits made. We made sure everything was how we wanted it. And we submitted it to HUD on March 26th. Heading off with April, we had our working group convened. We started our RFP process, and we had YALC members, we had adult partners, we had folks from education, we had folks from Colorado Human Services, and we even had our own CLC board members from Jefferson and Adams County join us for our RFP process. As of following up towards the end of May, from May 5th to the 31st, we did our RFP. We conducted we did the reviews of applications and potential on-sites. Our YALC members did select these final grantees, and we ended up, as I said previously, with 5 grantees receiving funding this round. And let's see, lost myself. So going into July 1st, we had our grantees all submitted and entered into eSnaps for HUD. So they knew these are the programs that we chose. These are the people we want to fund. These are the people we have leading our work. By August 1st, we finished up the final pieces of our CCP, had those sent out to HUD, and we began project launch and planning implementation for the rest of the year. YHCP, well, HUD is working with our YHCP grantees to get their programs ready to be launched, which hopefully we will be launching those in October of 2024. And hopefully our YALC will be a part of project launch and implementation for here on out. And next slide, please. So this is just our mission and vision that our YALC created using partner feedback. And I would just like to share this with you. Our mission is to create safe, compassionate spaces through person-centered care, honoring the unique experiences of every individual. We confront oppression boldly, with kindness amplifying the voices of all youth empowered by our community. We work towards a future where homelessness among youth is eliminated. We are guided by the unwavering dedication and compassion and understanding. We amplify the voices of youth most impacted by trauma, ensuring that they oversee services that help them. We are committed to fostering resilience and empowerment in every young adult we serve, recognizing their inherent worth and potential. Together with our community, we build a brighter tomorrow where all the youth thrive, grounded in principles of empathy, justice, and harmony. And with that mission, we created our vision. And our vision is that by 2028, all youth experiencing homelessness or at risk will have the resources and preventative measures to maintain and sustain safe and stable housing. We aim to empower youth experiencing homelessness by providing comprehensive support programs that promote trauma-informed care and offer peer mentorship. Our approach includes job training, mental health services, and educational opportunities, while encouraging their journey to resilience and liberation by supporting all their needs. We empower youth by restoring their voices and ensuring there's authentic youth collaboration within every step of their journey towards stability. Our strategy aims to create an environment where youth feel assured of accessing services without hesitation. And this will be accomplished through investing in our young people and young adults, empowering youth with decision-making authority, having monthly listening sessions to gain feedback, and having a continuous feedback loop from here on out. Next slide. So with that, these are the 3 programs, or projects that we decided to fund. We decided to do diversion and/or access points to help minimize being put into the system in the first place. We noticed some of our young folks, if they just had the preventative measures, they wouldn't end up homeless. If they just could get their rent covered for a month or 2 while they transition jobs, they would be perfectly okay. We also decided to do permanent supportive housing because our youth expressed that they did not like transitional housing. It was traumatic for them. So we decided to choose the alternative. Also, same for rapid rehousing, just one of those alternatives for housing that our youth really, really liked and really enjoyed. And with that, we have about $300,000 for our diversion/access points, $500,000 for permanent supportive housing, and $450,000 for rapid rehousing. Next slide, please. And these are our lovely organizations/grantees that we have chosen for this fund. For permanent supportive housing, we chose Family Tree, and they are getting a fund of $469,210 a year. And supportive services only, or that diversion/access point, we chose Florist Critton Services at $190,000 a year, and we chose The Road Call Straight at $130,000 a year. For rapid rehousing, we chose Hope House, giving them a fund of $122,879 a year. and Westminster Community Foundation, with a subrecipient of Almost Home, they get a fund of $357,000. And like I said, this is an annual fund. This is not the whole 2 years, but that total comes out to about $1,270,263. Next slide, please. So these are some of our next steps. So like I said, our grantees are actively working with HUD to get their projects finalized and get their contracts drafted. We have an in-person meeting coming up with our grantees here in September. Super glad to see some of you here today. Can't wait to see you guys in September. Hopefully, we will be launching projects in October 2024, maybe a little later, still working out the details. And we will have our YALC be helping with implementation of some of these programs at these organizations, which we are super stoked about and super glad to be actually helping with the work and helping to get our hands dirty, as I like to say it, honestly. But yeah, that's all I have for you. Are there any questions for me or maybe Rebecca if I can't answer them before we go on our 10-minute break, of course? No? All right. Well, thank you guys for listening to me talk your ears off for the last like 10 minutes. But yeah, back to you, Kyla.
Thanks, Ada. We're going to actually flip the agenda a little bit. It's going a little faster than we had planned this morning, which is great. All great information. We are going to move into coordinated entry updates, and then after coordinated entry updates, we will go on a quick break. So I'm going to pass it over to Megan.
Hi everyone, I'm Megan Morales. I'm the coordinated entry lead at MDHI, and my pronouns are she, her. So I'm just going to go over a few different things that we've been doing over the last 6 months. So I'm going to start with the update to the coordinated entry assessment. This was definitely a very long and iterative process. We heard a lot from the community that the VI SPAT was not an appropriate tool to be using to assess for coordinated entry for housing and vulnerability. So with guidance and leadership from our community partners, we moved to no longer using the VI SPAT. We started using this new assessment tool, which we're calling the Coordinated Entry Standard Assessment. There we go. Which we're calling the Coordinated Entry Standard Assessment. We started in February of this year, February 2024. We had an updated training as well that community partners were asked to do before they could start using this new assessment. So the month of January, folks were getting trained up with the new assessment, some other things about HMIS and the coordinated entry overview. And then in February 2024, we transitioned to using this new coordinated entry standard assessment, and we moved away from the VI SPAT. It was a data-driven decision-making process. It was really shaped by feedback from our community partners. We worked with the Young Adult Leadership Committee on the Young Adult and Transition-Aged Youth Assessment. We worked with the Results Academy on the Individual Single Adults Assessment. We worked with the Community Design team to really talk about all of our assessment tools. And the Family Solutions Group really led the conversation. Was the community partners that worked on the family assessment. So we still do have population-specific assessments. And we also worked with a lot of other community partners and households with lived experience. And then we really wanted to, with updating this assessment, to really center the goal of being more trauma-informed, being more accessible, and an equitable system. So this is a really exciting update. And we looked at every single question that we have on the assessment tool, and we really asked ourselves, why are we asking it and how we use those questions? Are we using it for prioritization or eligibility or understanding housing preferences and needs, and really kind of paring it down to just what we really need and not asking people questions just to ask questions. So really focusing on being more trauma-informed and making sure that anything we ask, we're using in some way or another. I'm going to pass it to Stephanie to talk about the family definition.
Hey everybody. So we are working on expanding how our COC defines family. So to kind of give some background, historically, family has been defined as a household that has more than one person that has at least one minor or dependent in the household. So we're looking to expand this to be more inclusive of various household composition types. So we began the process of changing the definition to more closely match HUD's definition, which basically says that any group of people that identify as a family can be considered a family and assessed as such. This shift will kind of promote a more equitable and inclusive system and allow different types of households to equally access access housing resources to meet their needs, and not have it stipulated that, because currently it's kind of a family that has a minor child, and then if there's adult-only households, they're currently assessed as each individual single adult. So we're kind of looking to make this change in 2 updates. So our first phase will be that we're going to remove the requirement of 50% custody of minors. So currently our definition requires that in order for a minor or dependent to be considered part of the family in our COC, the adult in the household has to prove that they have at least 50% custody of minors. So we're removing that requirement in order to include, families that are working on custody reunification, or they might still have partial custody, but not quite 50%. Households that are looking to just begin the reunification process and need to have unit size that's large enough for visitation while they're working on regaining custody. And then we will also be expanding the family definition to include pregnant individuals. And then Lynn, your hand is up.
Good morning. Hey, I was wondering on the 50% custody, because what I can see having issues about is that, let's say we have one parent already in permanent supportive housing that has 50% custody of a child, and then the other parent gets into permanent supportive housing. They also get the 50% in another place. So we're going to be using a lot more resources for a family. I mean, I thought it was 51%. But even at that, I think that there's a lot of gray area within that. Parents that want to have custody, but the plan is not for them to ever have it. What are we going to expect for that? It had always been, my understanding had been that you had to show that return home was the plan, especially if they were with social services. And we have several people in our single housing that would like to have their kids home, but they're probably not. So how are we going to manage all that? I just think it's a matter of resources, because there's not that many beds for families.
Yeah, I totally hear you. And the first thing is that we absolutely need more family resources, especially for families that need more than a 2-bedroom. So I will say that this will be kind of a learning curve for everybody, and it will be, I think, some case conferencing will be needed to kind of discuss if there are, 2 parents that are in, coordinated entry that are receiving services separately, kind of looking at what their current situation is and kind of just like discussing what the best options are for them. Ultimately, per HUD's guidance, we wouldn't want to take one of the parents' rights to have their child staying with them part of the time away just because one of the other parents has a bedroom for them. So, where I'm working with HUD to kind of, problem solve these issues, like I totally hear you. We don't want to take a ton of family units away and have fewer resources available for other families. And at the same time, we want to be sure that we're going about this in a person-centered way and make sure that we are, if there are minors and dependents that are in a family, making sure that we're able to house them together, and whether that person is just be getting their custody reunification plan, and they need somewhere to have their child come do visitation or like overnights for the first time, and they're just going to be there, you know, once a week or even less. That is still in line with what HUD is wanting us to do. So, you know, we have to balance that with also knowing that we have limited resources. And I think with that will come a lot of case conferencing on specific households and what their situations are, because this will look so different for every family. So we can't really make a blanket statement of exactly how it's going to go. It's just going to have to be a bit of a learning process for everybody, and just kind of, you know, deciding for each household what the best move is for them. Thanks, Lynn, for your question. And then we will have a second update, which will be expanding the definition to include any household with more than one person who identify as a family, regardless of presence of dependents in the household. And so this will allow adult-only households to receive services the same as more traditional family, and as our current COC defines it. And so this will shift some things in how we, you know, do assessments and how we make referrals. So this will also be a bit of a learning curve. And the second update is more farther into the future, because this will, you know, we do anticipate a lot of, you know, having to figure out details before we can go with this, but this will make our system much more inclusive for families, especially as we've seen a lot more multi-generational families in our COC over the past few years. And I think I'm passing it back to Megan.
Yeah, so I'll be going over coordinate entry data. This is a summary of our 2023 data, and this was presented in a coordinate entry, an overall impact report that was sent out in newsletters. But I'm just going to kind of go over the highlights of the impact report now. This first slide is kind of a general overview, and we'll dig a little deeper into these different numbers. But we want to say, first of all, we housed 1,788 total people. So that is including single adults, families, the minor children within the families, or dependents, and then young people as well. So 1,788 people housed. Of those 107, of those that big number, we have 1,443 total households. So whatever that household structure looks like, that is the total households. And then we had 1,559 assessments. That is people who are newly assessed for coordinated entry. It could also be people who were in coordinated entry in a few years ago or some other time, and they returned to our house or our coordinated entry system, and were either had a new assessment done as well. So it's new assessments in the coordinated entry system. We do have more people total in coordinated entry. So if I'm going to go to the next slide. Oh, Chris, I see your comment in there. So yeah, the first number is the unduplicated count of people. We have the emergency housing voucher program, which did come through coordinated entry. I don't believe we have a rough estimate. That's a great question. Most of that data of household structure lives with our housing authorities. So because, and we'll go into EHV data a little bit deeper as well, but because the EHVs were not required to, the housing authorities were not required to use HMIS, the coordinate entry team was doing all the data entry. And so we didn't always get the total household structure information from our housing authorities. So that's kind of why we ended up just adding our head of households, so that we are still counting people in HMIS, given that our coordinate entry team who's doing all the data entry weren't actually the ones completing intakes. We had a very pared down enrollment, so that we were just kind of capturing the total number of people in the household. We could potentially look at that. We wouldn't know for sure. We did have a field on our shortened enrollment that was the number of household members, but we can't verify exactly if that is what ended up being the household structure. So that's why it's a rough estimate. You want to go to the next slide? Oh, thanks, Chris. Thanks for your question. I don't know who's controlling the slides, but can we go to the next? Okay, cool. So yeah, this is digging a little deeper into our assessment data. So that 1,559 assessments that were either new or returning. And we had the majority of them actually from families. And as Stephanie was describing, what we're trying to do to update the family definition for 2023, it is still looking at household with dependents. So that 758 is household with dependents for 2023 data. And then our the light blue is our single adults. So we generally see a lot of single adults coming into our system, since that's a large portion of our unhoused population. And then we saw 61 youth or young adult assessments as well. This is for the head of household, is for the county assessed, is relative to the head of household. And we see the majority of our assessments coming in through Denver, being our county with a lot of services concentrated, and a lot of people experiencing homelessness, followed by Adams County, and then Arapahoe, Boulder, and Jefferson County. And then we're seeing the smallest number of assessments coming through from Broomfield and Douglas County. All right, so overall housing data. So this is for the 1,788 people, total household members. We saw the majority of people housed, or households housed, through rapid rehousing with 955 people housed through rapid rehousing, followed by permanent supportive housing with 510 people, and then housing only. So that is like a permanent housing resource that may or may not come with supportive services. Often in our coordinated entry system, the permanent housing resources do come with supportive services. They're just not categorized as permanent supportive housing. But yeah, so that 229 is some kind of subsidy, often a voucher in either project-based or tenant-based voucher, but that's where we see, that's what that housing only field is. And then 94 were housing with services. So yeah, those are kind of similar to the 229 for housing only, but just these resources that aren't categorized as PSH or rapid rehousing, but they are in our system. And then age tiers, we see the majority of people housed in our system being minors, 0 to 17. Those would be minors within a family household, so adults with minor children. We don't see young people who are not with the parent housed through coordinated entry, primarily because Colorado does not have emancipation laws, so you need to be 18 to oh, I see something, Debbie, in the chat. I just want to flag that for anyone who's monitoring the chat. And then yeah, so so that 0 to 17 is people that are within a household structure with some kind of adult household, head of household member. And then we see the other people that are the kind of households coming into our system that are end up having housing is those who are 35 to 44, followed by 55 to 64. And then kind of from there, the different age groups. So I don't want to read every single number, but yeah, as you can see, we kind of have a range of people who are housed as adults. And then majority of people who are males, people housed are males with 51%, pretty small, like not too big of a majority. We have females being 47%, and then non-binary and transgender people being at 1% both. We'll move to the next slide. So this is overall housing data. We have 1,443 households. Majority of those are single adult households with 1,065 single adults, followed by families with 275 households, and then young people being 103 households. And then we do see the majority of people housed through our system identify as white, with a little over 40%. And then our next largest group is people identify as Black, and that's a little bit less than 30%, followed by multiracial being a little over 20%. So kind of seeing that breakdown, and then the smaller percentages being American Indian, Alaska Native, Asian, Hispanic, and then Native Hawaiian or Pacific Islander. We'll go to the next slide. So this is specific to EHV data. And as I mentioned before, we really are primarily looking at the head of household. We did see some EHV data that came in where we were able to look at the household structure in HMIS. But for the majority, we really say that this is an undercount of people, but it is 229 households. We have the majority of those EHV housing placements through Denver Housing Authority and the Division of Housing, both had 108. And then we see Boulder County being 7, and then Boulder Housing Partners being 2. So there's 2 housing authorities in Boulder with EHVs, and then Maker Housing Partners, which is Adams County. So just for, in case anyone isn't familiar with the EHV emergency housing voucher, it was a time limited voucher that came through COVID funding. So we are not seeing new EHV. So I do want to flag that this is the EHV program is completed. All of the vouchers that come through the emergency housing voucher program have been issued. Majority have been housed. There may be a few lingering people still in housing search, but yeah, I just want to flag that this is kind of this program. We won't be getting new EHVs in our system. We can see the breakdown by age here. It's pretty similar to our general housing data. And then we saw kind of similar for our race breakdown for EHVs, though we did see instead of Black being higher at 30% and multiracial at 20%, those numbers were flip-flopped. So other than that, kind of similar breakdown. Similar with female, male, and non-binary, pretty much the same as our housing data, being 52% female. Well, actually, females is more than, ended up being a more of the majority for EHVs, 47% male, 1% non-binary. And then we saw majority as adults, single adults with 63%, families with 31%, and youth with 5%. Want to go to the next slide? Oh, I will put impact report.
I already did.
Oh.
I did, Megan. I put it in there.
Thank you so much.
Yeah.
So yeah, check out the link in the chat for the impact report. Want to go to the next slide? Okay, so I'm going to talk a little bit about the alternate process. Some of you are familiar with the alternate process, but I really want to highlight this. It is a method for people who are vulnerable, who are not being prioritized to the standard coordinated entry process, but are meeting some of these 3 criteria that I'm going over to provide an avenue for people to obtain housing when they meet these specific categories. So it's intended to be person-centered and provide this kind of this alternate process for those who need it. So when we're looking for the eligible people or households for alternate process, it's either households who are unable to complete the standard assessment due to their high acuity mental health conditions or other inhibiting factors. So they do need a release of information, but for whatever reason, completing the assessment process is not, it's not something that is obtainable at that time. But we still want to consider them for housing. And then the households that would be facing grave risk if continuing to endure homelessness, The grave risk definition is not super specific while also being specific, but we want to leave space for kind of different situations to come forward. So I'm going to read it and I'll put it in the chat, but grave risk in this case is defined as having or suffering from, but not limited to, an ailment, condition, or diagnoses that is or are terminal and or disproportionately exacerbated by homelessness itself and will not be resolved without housing. Thank you, Kyla, for putting that definition in the chat. Looking at that kind of, they're not coming up for coordinated entry through the standard process, but they're facing these really intense situations, co-occurring situations that put them at significant risk while they're experiencing homelessness. And then households that are actively enrolled in a one-home housing resource whose needs and or preferences necessitate a transfer to an alternate housing program. So that could be PSH to PSH, rapid rehousing to PSH, rapid rehousing to PH, or any kind of combination of those. But really it's just that their current housing isn't meeting their needs or their preferences, and we want to create space for transfers in our system to another housing program. You want to go to the next slide? I think this is the last slide I have, but I just want to go over alternate process committee data real quick. So we had 39 cases that were reviewed by the AP committee. 17 of those cases that were reviewed were immediately prioritized for permanent housing. And then we had 11 that were approved for a transfer to a permanent housing resource. That could be any of those program models I mentioned just now. And then 2 that were approved for transfer to rapid rehousing. The potential outcomes of an alternate process referral are either placing them on a priority queue for a housing resource. So we're prioritizing them for housing. Kind of a higher level of that prioritization would be prioritized immediately for the next available housing opportunity. So the committee decides that not only they should be prioritized, but it should be for the next resource that they are presumed to be eligible for, and that meets the household's interests or preferences. And then the third is a transfer from their current housing to another housing opportunity that better meets their needs. Then another option would be a change in prioritization from rapid rehousing or permanent housing to permanent supportive housing. So basically just prioritizing to a higher level of care for housing. And then we have the other last option or last potential outcome being denial for review from the alternate process. When we have alternate process referrals, the majority go through the committee, but there are some specific instances when it comes to transfers that are mainly just one home approvals. They just go through one home team. We have those outlined. And then they're also, when it comes to domestic people who are fleeing domestic violence, we can also kind of look at emergency transfer plans. So those generally don't have to go through the committee as well. Yeah, so that's the alternate process committee data. I don't know if there's any questions about alternate process or any of the other data elements we had. Chris, that without doing the math, I would say yes. So any of the people that were not on that data slide would be the ones who are denied either by the committee, primarily by the committee. So yeah, so we do see households that are denied, and I did not do the math, so I trust you on your math. But yeah, so any of those ones that are that aren't covered in the 17 category, prioritized for permanent housing, 11 for transfer to PSH or permanent housing, and 2 for rapid rehousing are those who are denied. Yes. Any other questions about coordinate entry data or the alternate process?
Great. Well, thank you, Megan and Stephanie, for that update. So we will go to a quick break, a 10-minute break. Get up, stretch your legs, fill your coffee, use the restroom, and we will circle back around at 10 after. Okay, we will get started again, and I am going to kick it over to Sophia to give us an update on regional coordination.
Beautiful. Well, good morning, everyone. I'm very excited to see so many of our passionate advocates and partners here today. I know we're all busy and it's Friday morning, and if you're like me and not a morning person, thank you for waking up and joining us as we continue our journey to solve homelessness in our region. For those of you who may not know me, I am Sophia Vigil. I have the privilege of working as the Regional Coordination Manager at Metro Denver Homeless Initiative. In my role, I focus on enhancing collaboration across our 7-county or 9 sub-region region through the Built for Zero framework. And so over the next 15 minutes, we'll dive into some exciting updates on our progress towards solving better in homelessness, reaffirm some of the goals that we have set out to achieve by the end of this year and by the end of 2027, and then also explore how each of you can continue to play a vital role in this journey. And before we get started on the updates, the data, that fun stuff, I just wanted to take a second to reflect on a statement that we see and hear throughout our work, and also reaffirm our mission and vision here at MDHI, which is to lead and advance collaboration across the region to solve homelessness. We hold a vision where everyone in our community has a safe, stable place to call home. And now, if you're driving throughout Denver, you'll see that clearly on a couple billboards. Thank you to our communications specialist, Layla, for getting those out there. If you want to see pictures of them, go to our social media pages and you'll get to see those wonderful billboards and the locations. So keep your eye out, but keep your eye out for the billboards, but also keep your eye on the road so you don't get into an accident when you're looking for them. And so, as I mentioned, I wanted to take a second to really engage you all in reflection on this statement that we see and hear throughout our work, which is homelessness is solvable. And as each of us plays a crucial role in this effort and share in this belief, we can strengthen and inspire our collective action. So before I get started again on the updates I have for you all, I wanted to hear from everyone here, well, maybe not everyone, but whoever feels like they want to share. Why do you believe homelessness is solvable? Feel free to come off mute. We have a nice intimate group here, so feel free to come off mute or feel free to put it in the chat. And so I'll give you a second to reflect, but I'm excited to see your all's answers and why you believe homelessness is solvable. And I can get us started because I was asked this question a couple months ago, and I was like, I say this all the time, and I have it even hanging right here in my office, and I look at it every day, but I'm like, why do I truly believe it? And I think it's because we as people created these systems that are operating right now. So we as people can also recreate them, dismantle them, shift them, and change them. So I believe we created them so we can solve it. And thank you, Chris. Yes, because not solving homelessness has been a policy choice. Yeah, Mandy.
Hi, I'm Mandy from Brookville County. My understanding is when you look at the data, like the data does show that certain efforts do move the needle and move towards solving it. So data and the research do support that idea that it is solvable. And I think I listened to a recent training where it said like certain methodologies and the reduction of veteran homelessness illustrate that as well.
Beautiful. And I'm going to need 5 answers before we move on. That's anything you can. So I will be patient. Okay, cool. Homelessness in the chat I see is ultimately a structural issue for our society, and we can make homelessness rare, brief, and non-recurring. Thank you, Bill. Yes, rare, brief, and non-recurring is what we strive for in this methodology.
I agree that it's a possibility, but unless it's politically feasible, and they start funding, and they start putting restrictions on how people buy up property and abuse it for profit, then we won't be able to solve it. So it's going to be up to politics.
Yeah, that's a great point. It's so true. I think I was a little naive when I first entered into this sector and this work 7 years ago, and thinking like, yeah, we got this. But over the years, yes, the politics are definitely a big player in this. And then I see another one in the chat, because it's human created system in the first place, who profits from the systems. Beautiful. I'll wait a couple seconds more to see if anyone else feels empowered to respond to this question, but we did reach my 5 threshold, so I can also. Wonderful. And if you think of anything else in the meantime too, feel free to add that into the chat. Those insights perfectly set the stage for discussing our progress and reaffirming our aims in this making this shared vision and mission a reality. So thank you for your contributions, and your belief and commitment are what drive our collective efforts forward. And we wouldn't be able to do any of this without you. So now looking at what are we trying to achieve as a region in the next 2.5 years. So we set these goals back now 2.5 years ago. We're halfway through. Let's reaffirm what they are so that we can achieve them or get as close as possible to achieving them by December 31st of 2027. So by December 31st of 2027, our entire region will, in partnership with our community members, will have quality binding data for all singles in 9 out of 9 subregions. This means we'll know every single person by name and be able to case conference and meet their individual and unique needs. We will have quality by name data for youth and families as well in the region. We will have achieved functional zero in all subregions for veterans, which means we will have effectively solved homelessness for veterans in our region. And then we will have also ended homelessness or solved homelessness for at least one of the following subpopulations in 4 of our subregions, which can be all singles, chronic, families, or youth. So these are what we are working towards as a region through the Built for Zero framework. And the next slide will give a few definitions on what this means, because we hear quality by name data, quality data. What does this all mean, and what does it mean when we are saying this in the community? So quality by name data is really a dynamic and up-to-date by name list of individuals who are experiencing homelessness in a community. It's a list that we will utilize to case conference off of, so that way we can meet everyone's individual needs and get them into housing as quickly and safely as possible. And quality by name data is important because it ensures accuracy, timeliness. It can inform data decision making. We can track our progress, which you'll see here in a little bit. It also provides accountability and ensures collaboration and working across the system. So how do we know when we've achieved this milestone? It's not something that people can just declare like, oh, we know everyone, we have quality data. It's actually, there's an assessment process that you have to do, which is a scorecard. So if you ever heard scorecard, that comes from Built for Zero, and it is what we are utilizing to assess our current homeless response system. It's for all singles comprised of 29 questions. And then for youth and families, I believe that's those questions are in like the 30s, I think 32 to 35 questions for youth and family, but it really is an assessment of where our homeless response system is through looking at our coordination efforts within a subregion, across the region, looking at our outreach efforts. Do we have coverage across our entire region? Where are those gaps, and are people entering into HMIS? And then also we'll know we have it when we can report these 7 data points each month, which are 1, actively homelessness. So at the end of each month, we'll have a count for how many people were actively homeless on that last day of each month. And then throughout the month, we'll have these different inflow and outflow points, which the inflow is looking at who's new into our system. So newly identified people entering our system, who's returned from housing placements, and then also who's returned from inactive, which is an outflow bucket. So we move people to inactive when we haven't had contact with them or seen anyone in the system in over 90 days. And then another outflow bucket is housed, which we of course want to see most of our people exiting into this outflow bucket. And then also the last one is no longer meet population criteria, which is an example of that is like a single youth who is now 24 turning 25 will transition and no longer meet that youth definition. So quality by name data, this is when we say this in our aim, this is what we're referring to. And then the next slide is the shared end state. So you'll also hear functional zero a lot, and this is what we're working towards. Right now, we're working towards it with veteran homelessness. So this is the definition. And it's so that the number of actively homeless veterans is lower than the average monthly housing rate, which for the entire region right now, I believe is in the low, it fluctuates a little bit. I think it's in the lower 30s number. And then on a sub-regional level, that minimum has to be 3. So the number of actively homeless veterans at a sub-regional level, if it is a smaller sub-region like Broomfield or Douglas County, they will have to have less than 3 actively homeless veterans at any time. And this was a term that was developed by Community Solutions to describe a dynamic state where homelessness is rare and brief when it does occur. So just as Bill mentioned in the chat earlier, it's not an absolute zero, but rather a milestone where a community has systems and capacity in place to ensure that any individual experiencing homelessness can quickly receive the support they need to obtain stable housing. And this is achieved also through a rigorous verification process, which involves comprehensive data analysis and local collaboration and coordination of efforts. So you'll hear functional zero, that's what it means. And the verification process does take a few months. So you have to go through all of that. And then now that we have those defined, looking at what we're looking to achieve by the end of 2024, now that we are ending August, so we're coming up on the last quarter of the year very soon. Earlier this year, we set out to achieve a 25% reduction in veteran homelessness, so going from 437 veterans to 328 who are actively experiencing homelessness. The entire region will be reporting quality by name data, so we will have achieved quality data for 9 out of 9 sub-regions. And then 2 communities will have solved homelessness for veterans. So that's achieving and sustaining functional zero. So these are the goals we set out to achieve earlier this year. And then our progress to these goals is around quality data for veterans. We're at 5 out of 9 right now. So we need 4 more regions to achieve that. Denver is currently starting the verification process, and the other 3 are to follow shortly after. So I believe that we will still achieve this goal by the end of this year. And again, it's no rush. We just want to ensure fidelity of the process, and it's okay if we don't meet that deadline, but we want to get us, or that goal, but want to get as close as possible as we can. And then functional zero for veterans. We wanted 2 by the end of this year. Douglas County is has finished up the verification process for this, so more to come in the near future on the celebration of this achievement. And sustaining, we have to verify first before we can sustain, so no one is in that bucket right now. And then when these slides are sent out, if you want to stay up to date on your subregion's progress, there's a link to a dashboard on this slide. And then the data to date, this is kind of small, but just tracking. So we've seen about a 5% reduction over this year. So we have, as of today, we actually have 410 veterans who are actively on our by name list, but just wanted to show we're not last year at this time, I think we were at a lower number. We had seen, I think, about a 25% reduction by this point, but it's all about sustaining it and ensuring people are staying connected to these services. So about a 5% reduction we've seen over this year. And the next slide will show we are tracking closely what Denver is doing in response to veteran homelessness and working alongside them and partnering with them. So not just tracking, but working with them, because Denver holds at any given point about 65 to 75% of our veteran population. So in order to end veteran homelessness in the region, we have to really have concerted and targeted efforts in metro or in the city and county of Denver as well. And they're at about 282 veterans right now. And then the 8 subregions, we're also following along with them because as you achieve quality data, we're also looking to achieve functional zero. And this picture shows, so Denver actually went up a little bit in July, but because the rest of the subregions most of them had a reduction or stayed the same, we were able to have a slight reduction over that. And then this was really exciting to see and put together. I'll just give a couple of highlights in that about 2/3, almost 2/3 of the veteran population that is exiting our binding list are exiting into housing, which is an increase from last year. So last year around this time, we saw exits around 50-50. So people were either being housed or they were becoming inactive at a 1-to-1 rate. And then, but this year we've seen an increase in housing placements. So that's very exciting. And then why I'm here, I'm here for a lot of reasons, but why I'm excited is because we're really making significant progress. Although the numbers might not show it, I've seen increased collaboration across our region, in our subregions, to really have this targeted and concerted effort to solve veteran homelessness. And this is due to what we put into practice for veterans. We will know it won't translate directly 1-to-1 for other subpopulations, but it will. And then, but it will help inform some of our policies, practices, and procedures. So that's very exciting. And if you know or are working with a veteran who's experiencing or even at risk of homelessness, we want to ensure they're getting connected to the VA. When these slides are sent out, I'll have Layla attach a brochure of how and where and when to get them connected. And then if you are currently working with a veteran who you know is already connected to services, we just want to reiterate that it's important to keep their information up to date in HMIS, as that is the source of data for all of this, this effort. And then my last slide is to just preview what is happening in the next 6 months. We're getting so much closer. You've been hearing me say this for the last year, but sometimes great things take time. And we've been working closely to develop a by name list of everyone who's experiencing homelessness in our region. So we're starting to transition our policies, practices, procedures to other populations. And we've taken on the effort of trying to identify a by name list for all singles out of HMIS. So leaning on the data that's in the system already. And then we're also excited to start supporting our young adult leaders to enhance coordination of our youth and young adult homeless response system. And then also we'll continue to communicate any progress, any education, and also celebrate our community wins over the next 6 months. So that's just a mini preview of what we'll be working on before you hear from us at our next stakeholder meeting. And that was all I had. I think there were some questions in the chat. Oh, and yes, as Sarah mentioned, if you go to our MDHI website, there is a great video, thanks to Layla and in partnership with Community Solutions, that outlines really what we're trying to work towards. And then there have been discussions with Valor Point with Community Solutions around Valor Point. I'd say they're in preliminary discussions, so very brand new still, but yes, that's a great point. Because Valor Point is a great resource and we want to encourage veterans to go there, and we know it resides in Jefferson County. So we'll have to talk through what that looks like as we get to a point where maybe all the veterans in Jefferson County, or most of them, are at Valor Point. So I'll keep informed, and thank you for flagging that, Rebecca. And yes, as Lynn mentioned, it is truly all about the Benjamins. So more funding and increased funding is needed to expand for all homelessness. That's why I mentioned we won't be able to translate one-to-one on our veteran efforts, mostly because the resources aren't as widely available, but some of the behind the scenes coordination, collaboration, and enhancing what we do have is something we can translate. So, thank you all. That's all I have. And if you ever have any questions or want to chat or want to get involved or want to hear more about what your subregion is doing, feel free to reach out to me. And I'll hand it back over to Kyla.
Thank you, Sophia. So just a quick wrap up. We'll do some quick MDHI updates, and then we will open the floor for some questions. But just some quick updates. We on Wednesday had our informational webinar for the Notice of Funding Opportunity that HUD has released. So that's the big annual program grant competition that they release every year. And so in addition to the annual grant, they also released a new NOFO as well, which is concentrated on bringing in new PSH units to the continuum. So just some high level dates that were shared on the Wednesday webinar, but you can also go to our website and get a recording of the webinar, but also find some more information. But the annual program NOFO, if you're a new applicant or interested in applying, we ask that you submit a letter of intent. The link for that can be found on our website. The program applications are due in eSnaps on the 20th, and then we will be posting for public comment the consolidated or the collaborative application on the 7th of October, and then the final will be submitted to HUD on October 28th. So that is just, again, high level real quick on the program NOFO. And then for the COC PSH NOFO, it's running in parallel, but it is due a month later. So the deadlines are kind of spread out a little bit more, but the RFP for how to apply for that opportunity will be released next week. And the letter of intents will be due September 9th, with the applications due October 23rd. And then the final application we will plan to submit to HUD on November 15th. So again, visit our website if you have any questions. You can also email us at NOFA, N-O-F-A, @mdhi.org if you have any questions, and we're happy to follow up with you on the NOFO process. Another thing is, as if you are following up on our communications, if you don't, I highly recommend that you sign up for our comms. We send, Layla does a really good job of putting everything together and getting those out. And so you will find information on the NOFO, the regional updates, coordinated entry updates, all those updates that we've talked about today. You can stay up to date on those in our monthly comms, and we will put a link on how to sign up for those. But we are currently underway for actively searching for our executive director. So that process is underway, and so I would stay tuned through our monthly communications as we progress through that process. And then, not featured on the slide, but another reminder that I want to plug is that MDHI is partnering with the Corporation for Supportive Housing, or CSH, to deliver a series of 8 virtual trainings. And so those trainings will start in September and continue on each month until 8 trainings have been completed. With the first training being focused on housing first. And so we highly recommend that you have somebody, either yourself or somebody from your organizations, attend those trainings. They'll be very useful information. And then part of the trainings, they'll host a training, and then a couple weeks later, they will do a kind of applied learning session. And so that's just a way for you to connect with the folks at CSH to do kind of a more one-on-one it's a group session, but kind of hands-on learning to ask questions, specific questions related to your project. So there's kind of 2 sessions. There's the main session and then the applied learning for each topic. And so to find out more information or to sign up for those trainings, Rebecca has put the link in the chat, or you can find those on our website as well. So that is all we have for you all today. So again, thank you all for attending. We will stay on. If you guys have any questions, curiosities, would like to learn some more that we weren't shared today, we will stay on for, I'd say about 15 minutes unless we don't hear anything. But if you don't have any questions, feel free to jump off. And again, we thank you for coming, but we will open the floor now for any questions.
Hey, Carla, this is Lynn. I was wondering, I heard that there may be a reduction in some of the, and I don't know if it's coming from HUD or from MDHI or what, some of the PSH projects, or maybe it's a reduction in the amount requested. Do you know anything about that?
So we did get our annual renewal demand amounts this morning. But what we have heard is that we haven't heard there's a reduction. It's just they are shifting the amounts that are in tier 1 versus tier 2. And so the tier 1 funding is kind of the guaranteed funding. And then the tier 2 funding is the kind of competitive funding. And so we have heard that we will only get 90% of the guaranteed funding in tier 1, whereas last year we got 93%. So it's not necessarily a reduction, it's just they're kind of shifting the pot from 90% in tier 1, which leaves 10% in tier 2 or the COC bonus funds. Does that answer your question then?
You know, it's a confusing system, so I don't know that I'll ever understand it. But so does that so that's for the 24, 20 or 25, 26? Is that what we're talking about?
Yes, it's fiscal year 24, 25, but for contract, your contracts would be 25, 26.
Okay. Thank you. Thank you all. Have a great day. Weekend, I guess, really. Yay.
Thanks, Lynn. And we will stay on until about 45 minutes after, in case you all have any questions. If questions come up after, feel free to reach out to us directly as well. We're happy to answer any that may come up after.